Hello, I'm Dr. Mikkel Jarman, a leading expert in pediatric foot and ankle care. Today I'd like to bring you, the parent or the patient, literally into my office today to see exactly how we fix that dreaded ingrown toenail. Though there are many factors that can cause ingrown toenails, they can present at any age, including a 2-month-old baby or your teenage child. It's estimated that more than 3 million individuals each year suffer with this condition, and here at Pediatric Foot and Ankle, we are literally fixing them one toe, sometimes 2 toes, at a time. Every situation is different and every child can react differently to these procedures. But let's meet Ashton and follow his experience today.
Ashton, right? He has got, this is a paronychia, this is the ingrown toenail. Typically, these will come in different variations. Typically, it's a wide nail, but in this case, it actually is your anatomy. Look, you got this kind of curly toe. Uncle Jimmy gave you this toe. Mom or dad has probably a toe like this though. And what happens is that you do a lot of athletic activities, these toes sit and rub together, and it's just the anatomy and it cuts into that. So to fix this, we can either break your toe or just remove a sliver of that nail. And so we're gonna opt to remove that sliver of the nail. So I'm gonna make it go to sleep here. And so I'm gonna tilt Ashton back here. And what we're gonna ask Ashton to do is not watch, but to just close your eyes. And I'm going to spray something called cold spray. And Yvonne has this, so you see that stuff right there. That will make it feel like an ice cube on your skin. And if you don't watch here, it's gonna feel like I'm pinching your toe for about 5 seconds. So you're gonna feel some pressure here. You're gonna feel all the way down on the bottom of your toe. Doing so good. You're gonna feel over here on the other side. Okay, that was it. So now we're gonna give it, not too bad, right?
Not too bad.
You didn't scream. So we're gonna give this about 8 minutes. I'll be right back in. At that time, everything will be asleep. I'm gonna make sure it's actually asleep here. I'm gonna put your foot out like this. This is an iodine. It looks like barbecue sauce, right? What you're gonna notice is it feels really weird, right? It feels, kind of tingles a little bit. Okay, so we're gonna check. So pressure you should feel, right? But no pain. Yeah. All right, so what we're gonna do is, just to show here is how far down that nail really goes down in there. It's pretty far. So all we're gonna do is just push that back a little bit. We're gonna free that up. Just a hair. And this is an anvil. We're gonna just trim off a little piece of that nail. So we're not going crazy with the amount of nail removing, but if you're gonna say I'm gonna take this, we're gonna roll it right out. And we can see here. Let's get rid of all that garbage. So here's a piece of nail that you don't see down in there. Got a little piece of skin on there, but you can see how big that piece is that rolls in there. We're gonna just scar up the root there so this phenol wants to take. All right, so now this is the exciting part. We're just waiting. Yeah. Again, there's the There's a chunk of nail that came out of that guy. The show and tell. Wait. Alright, there we put this in here. This just neutralizes that acid. And then this is an iodine gel. We really like this. And just put that stuff down in there. And when you do the dressing changes, you're just going to put a Band-Aid on tomorrow. This will stay on all day today. And you're going to put a Band-Aid on with that iodine for about 5 days. That's it. And then there won't be a follow-up, but we're going to send a picture or text you in a week and a half for a photo. We just want to make sure you don't have what's called a catch, because about 1 in 20 of these will have what's called a catch. And you'll know because there'll be still some drainage coming out of that. And if you have that, we just need to see you to trim a little piece of nail, but you don't have to numb it up, you know.
I'd like to thank Ashton for being so brave and for his mother allowing us to film. Performing these permanent ingrown toenail procedures on children are the most common procedures we do every day here in the office. If your child is suffering with an ingrown toenail and you'd like to explore a pathway to fix it, please call our office today and make an appointment. I'm Dr. Mikkel Jarman. Thanks for watching.